Hello. So we have stepped into the month of December, and a big chunk of patients that I see in OPD are coming for the cause of cough with very thick phlegm and a lot of congestion. And they request to give something to liquefy the cough so that the phlegm comes out and they feel comfortable. They are coughing too much cough. Too much of cough is there in an attempt to remove that phlegm. So, if such a patient in the month of like in the beginning of the December visits a modern medicine practitioner, so how will a modern medicine practitioner look into this is that since it is acute in origin, it can be because of some pre-existing allergy that the patient has. It can be due to some viral infection due to season change. It can be due to cold, which has come up, and the upper respiratory tract infection has begun. It can be due to some rhinosinusitis uh, exacerbation, which is causing postnasal drip and things like that. So, if the patient has cough which is producing a thick phlegm, the doctor will prescribe some mucolytic drugs like ambroxol or bromhexin. The doctor can also give um, uh, like bronchodilators like salbutamol, which is a beta 2 agonist, or some anticholinergic bronchodilator if the patient has breathlessness. But again, the anticholinergic will reduce the phlegm secretion, reduce the liquid portion of the phlegm, which will again cause dry phlegm. The antibiotics can be prescribed if the infection is supposed to be bacterial. The H1 antihistaminics like levocetirizine, leukotriene antagonists like montelukast will be given. Now, if the cough is so much that the patient is feeling very uncomfortable and is having a lot of chest pain because of that, because of coughing continuously, then antitussives like dextromethorphan can be given, which is not recommended when the phlegm is there, though. But to relieve the patient, the doctor will have to be like doctor will have to judge case to case. We can also give some pharyngeal demulcents like it's like some lozenge to soothe the pharynx so that the urge to cough is reduced. And if the cough is of chronic kind, if the patient has chronic bronchitis which exacerbates during cold, then the appropriate treatment is given for the chronic conditions. So, this is how a case of cough coming to a modern medicine practitioner would be dealt with in the early days of December. And if such a patient comes to me as an Ayurvedic practitioner in the month of December, so it is the beginning of Hemant Ritu. And in Hemant Ritu, there is a Vat Prakop because, as described in Charak Samhita, the Agni is too much. Patient has a lot of uh, digestive fire. The digestive fire is very strong, and because we are not accustomed to that kind of lifestyle before the arrival of Hemant, so it is a probability that we have been eating less, not in proportionate to our digestive fire. So the vata gets aggravated with a good digestive fire. So probably in this month, the patients who are coming, the most common, they have Vatic cough. Even if we look into the shloka of Charak Samhita, which explains Vatic cough, we have very exactly similar symptoms which the patients are coming with. So it says like Hrit Pashu Ura Shira Shul. So a patient has pain in the chest region, in the thorax, the headache, uh, and in the sides of the thorax. So Hrit Pashu Ura Shira Shul, and then there is um, uh, Shushkura Kantvakrasya. The patient will complain that there's a lot of dryness in the throat, there's a lot of dryness in the mouth, and uh, Kafam Alpam Krichan Muktva Alpatam Vrajet. I may be erring a bit in the shlokas, I'm sorry, but my sense is that I'm trying to explain Vatikas. You can see the shlok in the Samhita. So the phlegm is less and the patient feels relieved once the phlegm is out. So this is what the symptom I am seeing presently in the OPDs these days. And if a patient like this with Vatic cast comes to me, so I'll treat accordingly as per the dosha. So I'll try to treat the patient with some kind of grita preparation like Kantakari grit, maybe Vasa grit, seeing if the patient has Ampachan. So if the signs of Niramta are present, I'll start with some grit like Vata grit. And in the meanwhile, if the patient is having some symptoms, then I'll try to treat with something like Eladivati, Lagu Shekaras. Even if I don't have anything in my OPD, if I'm giving Sitopaladi churn, I'll give with something, some Grita as anapan. If I'm giving Talishadi churn, I'll try to give with Grita as anapan, so that it is not further irritating the pharyngeal mucosa, but trying to soothe it down so that the reflex of cough is reduced. Hope that was helpful. Thank you.